Hello everyone. Today in the series of Docplexus interviews, we have with us Dr. Wasim Ghori, who is the Medical Director and Consultant Diabetologist and is the Medical Director at Heart and Diabetes Clinic, Mumbai. He holds an MBA in International Health Services and Hospital Management from London South Bank University, where he spent considerable time studying the National Health Services. He is also the founder of the award-winning RX Healing Canvas and partners with healthcare leaders with the aim of using visual art in designing aesthetically pleasing hospital environments. He serves as the Executive Director of MaHIMA, which is recognized by Maharashtra Medical Council and aims towards digital transformation of healthcare from paper to paperless, especially in medical value travel. The British Council appointed him as the brand ambassador for Education U.K, highlighting his outstanding achievements as a healthcare leader. Thank you, Dr. Ghori, for being with us today.
Thank you very much, Dr. Kritika. That was quite an elaborate introduction. Appreciate.
Thank you. So today's topic of discussion is challenges and future of medical tourism in India. Shall we start?
Sure.
So first question, Dr. Wasim Ghori, can you please explain the current scenario of medical tourism in India?
Well, to start with, I would like to quote the famous Indian proverb, which is Atiti Devo Bhava.
Atiti Devo. Right.
In essence, in India, we look up to guests and consider them as next to gods. I think that personifies very well in the Indian values and culture. And one of the reasons why tourists coming to India, enjoying the hospitality and the care and medical space is primarily because of the essence that we Indians have in our DNA.
Exactly.
And it fits in well with the proverb. Having said that, medical value travel is thriving in India, and annually it attracts more than 5 lakh travelers from different parts of the world. Medical value travel is also gaining strategic importance, primarily because of its ability to generate employment opportunities, exchange culture, position the country through its soft power, as well as attracting foreign revenue to the respective countries. We are living in an age where, or rather, age of globalization, and there is emergence of the culture of consumerism. In that regard, there is an increasing tendency among the people to travel in search of better healthcare options at an affordable cost.
Yes.
People do travel looking for the latest medical technologies, accreditation facilities, and especially the minimum waiting time. Furthermore, the medical tourism space and the preferred destinations have moved away from developed nations like the US and countries in Western Europe to developing countries, especially in Asia. With the rise in geriatric population and healthcare turning costlier in the Western world, several countries in Asia have developed systems, ecosystems, which are necessary to become MET hub. With that context, I would like to say that India currently stands 5th on the medical tourism index globally amongst 41 major medical tourism destinations. However, there are concerns and gaps in the ecosystem which needs to be addressed both from the government and the private healthcare providers, which can certainly elevate India to number 1 as the most preferred destination to medical travelers.
True, Dr. Ghori, I totally agree. India actually stands one of the top preferred destinations for medical tourism.
Right.
Yes. So, having said that, in your opinion, what is the status of countries' medical tourism on the global map?
As I said, India ranks 5th.
Yes.
We have, or rather, I'm very proud of my country, India, which has been churning out some of the best doctors of international acclaim. We can boast of providing quality healthcare at an affordable cost. We have highly qualified, certified, well-trained nursing staff. We have 38 odd JCI accredited hospitals in addition to 619 NABH accredited hospitals. So with that level and quality of infrastructure, I see no reason why India cannot be the number one.
Exactly.
I think we need to address the gaps in the ecosystem and engage with various stakeholders in the whole MVT value chain.
So, Dr. Ghori, in your opinion, what are the factors that are beneficial for medical tourism in India?
Factors beneficial for medical tourism in India, if I would like to enlist, top of the mind comes the low cost.
Low cost.
And I can vouch for that. We've been having patients coming from the Middle East, Africa, Southeast Asia, even European countries, coming to India mainly for the cost reason. In the US, as you know, the diagnostics and the laboratory services again are not covered.
Yes.
So patients do come from that part of the world to India to, make sure the healthcare needs are addressed at a fraction of the cost. Furthermore, we have got the best trained doctors across various specialties, be it cardiology, oncology, IVF, cosmetics, dentistry, you name it, we have it.
We have it.
India also boasts of some of the well qualified, highly trained, specialized nursing staff. And not to forget the hospitality services. Again, I would like to mention the role of Ayush. In addition to modern medicine, which is being offered by other source countries, what makes India unique is the traditional medicine, which is now being recognized as an alternative medicine. In that regard, we've got some of the best Ayurveda centers in Gujarat, in Kerala. People do come to avail of that service as well. So I think Ayush is also one of the main strengths when it comes to medical tourism and India. And medical travelers do seek out Ayush therapy when they think of a destination, if you like.
So, Dr. Ghori, are there any particular diseases, or do you think is there any particular therapeutic area for which travelers are basically coming to India for getting the treatment?
Well, in my practice, I've seen patients coming for seeking services in the field of cardiology, orthopedics, whether it is knee replacement or hip replacements. Patients are coming for fertility care. Patients are coming for dentistry, oncology. So these are the main specialities which patients seek out when they think of India as the destination.
Right. So when we talk about medical tourism and promotion of medical tourism in India, what do you think, what is the role of government in promoting medical tourism?
Well, government is one of the key players in the whole medical tourism ecosystem. And in that regard, I would like to take this opportunity and commend the efforts of the Government of India, wherein they have brought in Ministry of Health and Family Welfare, along with Ministry of Tourism, along with Ayush, Ministry of Commerce and Industry, as well as these various bodies coming together promoting India as the destination for medical tourism. In addition to that, the efforts made by Niti Aayog, they are doing some real work in terms of developing a roadmap for this particular space in India. newer medical visa regimes, allow patients to have multiple entry visas. So that helps. So yes, government has taken real, key steps
Right.
in kind of instilling a discipline in this particular space, which is at present a bit fragmented. But I'm sure with efforts of enlightened people, and leaders in India, we will certainly be able to close the gaps, address the needs, so as to offer seamless patient experience to foreign patients.
So moving forward, Dr. Wasim, in your opinion, which of the states in India are specialized in point of medical care?
Well, in India, the major tourist destination cities, if you like, are Delhi,
Yeah.
Mumbai, Kolkata,
Kolkata.
Bangalore, Hyderabad, Chennai, Kerala as a state.
Yes.
As I said earlier, Kerala is the preferred destination for Ayurveda centers.
Okay.
Approximately 27% of tourists they travel to Maharashtra for their healthcare needs, out of which 80% they come to Mumbai. Around 15% of the tourists they travel down south to Chennai, and around 7 to 8% travel to Kerala for their healthcare needs.
Okay. So basically, it is Mumbai and Chennai, right?
Yes,
When we talk about the states.
that's right. Yeah.
So, what is the future of medical tourism in India, and what tips would you suggest?
As far as instilling a discipline in this MVT space is concerned, starting with promoting India as a brand, especially on international platforms.
Yes.
We can always promote India as the health and medical tourism destination. MaHIMA, for that matter, is organizing an international event promoting India as a global tourist destination. This will be held in Paris. Likewise, we can have target group oriented branding and marketing campaigns like Heal in India.
Yeah.
We can have a platform where medical tourists can directly engage with different stakeholders so as to feel reassured even before they come down to India for the treatment. As far as regulations are concerned, uh, I would like to add one thing. Medical value travel facilitators, if they can be clubbed together in an association so as to promote self-regulation, we can do coordination between various source countries at government and institutional level so as to strengthen the linkages and the tie-ups. That will also improve the tourist numbers. Of course, formulating a code of ethics or a MAT policy at government level is something that will be the key going forward.
Okay. So, when we talk about going forward and the future of medical tourism, where do you see India in the coming years?
Well, as I said earlier, India at the moment is attracting more than 5 lakh travelers across the globe. If we are able to address the concerns, ensure that we brand India as the destination at various international conferences, and India does stand to elevate its current position and become the most or the preferred destination. In that regard, I would like to invite Docplexus community to come forward and be part of the various medical value travel or medical tourist conferences that we are organizing both nationally and internationally. And if we are able to do that, India would certainly be, the key player
True.
in the future. And become the preferred destination
Preferred destination.
for medical tourism.
Yes. I'm sure the time is not far.
The time is not far, and coming April in Paris, France, MaHIMA is organizing a 4-day event
Yes.
where we are engaging with the Prime Ministers of India, the Niti Aayog, the Ministry of Health and Family Welfare, the Ministry of Health and Family Welfare, Ministry of Tourism, Ministry of Commerce and Industry.
Yes.
On the government side, we are engaging with the healthcare providers, the accreditation agencies, the regulators, and the insurers. We are engaging with them and bringing them all together under one roof, so as to have a dialogue and exchange of knowledge transfer and understand what key areas we need to address, so as to take and make India the preferred destination for medical tourism.
That's great, Dr. Wasim. Good luck to you for that conference.
Thank you very much.
Lastly, would you like to share any key message with the Docplexus community?
The key message for Docplexus community, innovation is the key, and we have to embrace technology, whether it's healthcare, whether it's pharmaceutical industry, whether it is healthcare IT, whether it is digitalization of health records. So embracing technology, embracing innovation, embracing creativity is the key going forward. And that's how we will be able to stay ahead of the game. And I wish all the very best to all my colleagues at Docplexus community. And thank you once again, Dr. Kritika and team, for inviting me to Docplexus studio. Thank you very much.
Thank you so much, Dr. Wasim, for sharing your views with us.
Pleasure.
It was certainly an insightful discussion.
Pleasure.
Thank you so much.
Thank you very much.